Hi, my name is Matthew Peplinski, and today you will be listening and watching my presentation on the history of healthcare in the United States. So we're going to start all the way back at the 1900s. At this dawn of the new age, doctors were no longer expected to provide free services to all hospital patients. Before, there wasn't much prestige in the job, and they kind of just did whatever they could to help, but weren't really specialists. But at this time, doctors gained that, and surgery is now common. Common surgeries such as removing tumors and appendectomies. Going into 1910s, progressive reformers argue for health insurance. They fight for citizens to have health insurance, and they're actually gaining a lot of support. That is until physicians and interest groups oppose this reforming of health insurance. And the entry of U.S. into World War I kind of swayed the public's attention from healthcare. Going into the roaring 1920s, costs continue to rise for health insurance. At this time, doctors' incomes increased greatly along with the prestige of the job. And at this time, General Motors was the first company to sign for health insurance for their workers, insuring their 180,000 workers. Going into the 1930s, the Depression changes the priorities of the nation, and there's a greater emphasis on unemployment insurance. And the Social Security Act is passed with no health care coverage, which was a very big deal. A lot of people fought for that to be included in the act, but eventually it was voted down, and it passed without it. Going into the 1940s, penicillin begins to be used in hospitals, and to compete for workers, companies begin to offer health benefits over another, and this gave rise to the employer-based system that we have in today. Also at this time, presidents made the news concerning health insurance, and President Roosevelt asked Congress for the Economic Bill of Rights, which includes the right to adequate health care, and it was shot down. And President Truman offers the National Health Program Plan that would include all of American society, but the plan was denounced and called a communist plot by the subcommittee. Going into the 1950s, many legislative proposals are made for different approaches to health insurance, but none succeed. And in this time, what was a very big deal is the first successful organ transplant is performed, and many more medicines and vaccinations are now available throughout the country. In the 1960s, the price of healthcare through the 1950s doubled, and so people have huge difficulty affording it. And President Johnson signs Medicare and Medicaid into law, which was a really big move because before then the government had almost no say in health insurance. It was just all company-based. Now going into the 1970s, the American medicine is now seen as in crisis. This is due to Medicare expenditures and inflation due to the economy. Also during this time, President Nixon's plan for health care insurance was rejected by liberals and labor unions. Also at this time, the number of women entering medical profession rises dramatically. In 1970, 9% of medical students were women, but by the end of the decade, that proportion exceeded 25%. Also, the World Health Organization declares smallpox eradicated. In the 1980s, there begins a shift towards the privatization and corporatization of healthcare, being completely in control by the companies, and Medicare shifts to payment by diagnosis instead of by treatment, and the private plans quickly followed suit, and this was a very big deal because at the time, Medicare only paid when you had treatment, but now it only paid for diagnosis, which was really, I mean, there's opinions that go along with it, but this was a very very bad thing concerning just people's health. Going into the 1990s, healthcare costs continue to rise, this time at double the rate of inflation. And by the end of the decade, there are 44 million Americans, which equals out to 16% of the United States, with no health insurance. And this is when the public first began to really notice how many people were uninsured and the real problems going on in the medical field. In the 2000s, the direct-to-consumer advertising for pharmaceuticals and medical devices is on the rise. Before then, you saw typical things such as Advil and Tylenol on TV. Now they're promoting, you really notice it turning on the TV anytime today. You notice all these companies such as Lunesta that really advertise heavily. And also at this time, Medicare is viewed by some as unsustainable under the present structure, and you hear a lot of protests on health insurance. There are films such as Michael Moore's Sicko that delve really into the issue and show really the heart of the problem going on. And now we move into today, in the 2010 era, and after much debating, it took away, even though passing the bill took away much of what Obama wanted, Obamacare package was passed, taking a very small step towards helping mend the current healthcare system. And I'm completely positive that within the next 10 or 20 years, we will see a huge change in how healthcare works here in the U.S. And yes, it's going to be a very exciting time to see how we can help the situation. And that was my presentation. Here are my sources, and I hope you enjoyed it.